Hello, I'm Dr. Todd Jackson, board-certified ophthalmologist. Today we're going to be talking about dry eyes. We have patients come in all the time with symptoms of dry eyes, redness, irritation, tearing even. I'm going to go over the diagnosis of dry eyes and some of the treatment options. Let's go over a little bit of the pathophysiology of dry eyes. So here is the eye, cornea, iris, intraocular lens. Then we have our eyelids. And within the eyelids are several different glands. The glands that I'm going to be focusing on are these Meibomian glands. If you looked at the eye from this standpoint, these Meibomian glands line the inner surface of the lid. There's approximately 30 below, and there's about 10 or 15% more above. Now, in dry eyes, what ends up happening is that the ocular surface is covered by a tear film. This tear film grossly consists of 3 layers. Okay? The top layer being oil secreted by these Meibomian glands. The second layer being water. Not really, but it's the aqueous portion of it. And the third layer being mucin. So when you're having dry eye symptoms, which, by the way, one of the dry eye symptoms is tearing. So patients come in and say, "Doc, I'm tearing all the time." And then the doctor says, "Well, you have dry eyes." And they say, "Are you not listening to me? I just said I'm tearing." Well, the pathophysiology of that is when the eyes get dry, the lacrimal gland will over-secrete tears, and hence one of the most common presenting symptoms of dry eyes is excessive tearing. So when you come into the office, what we want to do is evaluate your tear film. The normal, when we push on the inferior eyelid, we should, about 10 or so of those Meibomian glands to secrete a nice olive oil-like substance. And then we do a Schirmer test where we put a little special tissue paper that measures the amount of fluid that's being produced. And the normal is somewhere between 10 to 15 millimeters within 5 minutes. And then mucin, the mucinous layer is determined by tear breakup time. So when you come in, we'll actually look at the tears, evaluate what layer of the tear is having the problem, because based on if you're having an oil issue or a water issue or a mucin issue, the therapy will be targeted toward that particular deficiency. For example, most individuals, over 80%, have an oil deficiency or Meibomian gland dysfunction. That is primarily treated. We then image those glands to make sure that they're present. If they're present, we want to see if they're blocked. And treatments can involve unblocking those glands and then maintaining those glands so that they flow and produce that healthy oil film that keeps the aqueous from evaporating off. I hope this gave you some insight into dry eyes and how it can be worked up.